ಎಲ್ಲರಿಗೂ ನಮಸ್ತೆ. ಶುಭ ಸಂಜೆ. ನಮಸ್ತೆ ಅಶೋಕ್ ಜಿ. Good evening, everyone. The session is about to start in 5 minutes.
नमस्ते। नमस्ते सभी को मेरा प्रणाम। प्रणाम सभी को प्रणाम।
ಆತ್ಮೀಯರೇ, ಇನ್ನು ಕೆಲವೇ ಕ್ಷಣದಲ್ಲಿ ಆನ್ಲೈನ್ ಸೆಷನ್ ಸ್ಟಾರ್ಟ್ ಆಗಲಿದೆ. ನಿಮ್ಮ ಇತರೆ ಸ್ನೇಹಿತರು ಹಾಗೂ ಪರಿಚಿತರನ್ನು ಆನ್ಲೈನ್ ಸೆಷನ್ಗೆ ಜಾಯಿನ್ ಆಗಿ ಅಂತ ಹೇಳಿ ಒಂದು ಮೆಸೇಜ್ ಅನ್ನ ಕೊಡಿ, ಜಾಯಿನ್ ಮಾಡಿಸಿ.
इंग्लिश
Good evening, everyone. Good evening, Dr. Ashok ji. Namaste.
नमस्ते.
Namaste. Dr. Varsha Padhe here from Raichura. कसे आहात? आराम ना?
हाँ.
Good evening, ladies and gentlemen. I request everyone, the program is about to start in a couple of minutes. So please request your friends and the known person or the people who are in your group to join this session and know much about the program. Gayatri Akka, are you in this session? Gayatri Akka? Gayatri Akka, shall I take couple of minutes because still people are still joining, or shall we start? Akka. One second. Okay. A very good evening to one and all those who have joined this today's online session. I heartily welcome you all to this session. I hope I'm audible to everyone because that is the one constraint in online sessions. If our voice is not clear, so nothing is interested. Everything can wait for us, but time won't wait for us. We can wait for it. So let us start quickly today's online session. I welcome all the members and the guests to this program, especially Honorable President Dr. Ashok Kale, MBBS MD, ex-professor, ABGP founding member. I heartily welcome you to this session, sir.
Thank you.
We know that it is a customer that we always start our program with Grahaka Gita. I request Sri Lakshmi Akka to sing Grahaka Gita. Sri Lakshmi Akka, are you in online?
ಹಲೋ ಸಮಿತಾ
Ha, Subhadraka.
ಅಲ್ಲ ನೀವು
Sorry,
ಹೇಳಿದ್ರಲ್ಲ
Subhadraka. I'm sorry. I did a mistake here. I'm sorry. Subhadraka, can you please sing Grahaka Gita?
ಓಕೆ ಕೇಳಿಸ್ತಾ ಇದೆಯಾ ಸಮಿತಾ ವಾಯ್ಸ್?
Ha, it's clear. It's clear. Your voice is clear.
ಎಲ್ರಿಗೂ ನನ್ನ ನಮಸ್ಕಾರ. मानवता के लिए उषा की किरण जगाने वाले हम, शोषित पीड़ित ग्राहक जन का भाग्य जगाने वाले हम. जय ग्राहक, जय ग्राहक, जय ग्राहक शक्ति. अन्य किसी के मुंह की रोटी हरना अपना काम नहीं, पर अपने अधिकार गवा कर सकते आराम नहीं. अपने हित औरों के हित का मेल मिलाने वाले हम, शोषित पीड़ित ग्राहक जन का भाग्य जगाने वाले हम. जय ग्राहक, जय ग्राहक, जय ग्राहक शक्ति. रोटी कपड़ा मकान शिक्षा आवश्यकता जीवन की, व्यक्ति व्यक्ति परिवार सुखी हो तभी होगी मुक्ति सच्ची. हंसते हंसते राष्ट्र कार्य में शक्ति लगाने वाले हम, शोषित पीड़ित ग्राहक जन का भाग्य जगाने वाले हम. जय ग्राहक, जय ग्राहक, जय ग्राहक शक्ति. भारत माता का सुख गौरव प्राणों से भी प्यारा है. युग युग से मानव हित करना शाश्वत धर्म हमारा है. जीवन शक्ति उसी माता को भेंट चढ़ाने वाले हम, शोषित पीड़ित ग्राहक जन का भाग्य जगाने वाले हम. जय ग्राहक, जय ग्राहक, जय ग्राहक शक्ति. जय ग्राहक शक्ति. ग्राहक शक्ति राष्ट्र शक्ति. धन्यवाद जी.
Thank you, Subhadraka. Today's session is an awareness about the pregnancy issues, natural childbirth, and maternal mortality. So, during the session, I request everyone not to disturb. Please, if you have any questions, put it in the chat box. So that the questions will be forwarded to today's speaker after the end of the session or at the end. So I request everyone to keep your microphones in a mute so it won't disturb the session. Thank you. And I request Sri Lakshmi Akka to introduce today's guest speaker.
Hello, Samhita. This is Vijayalakshmi here. I'm going to introduce the guest. Can you hear me?
Yes, Akka, your voice is clear.
Namaste ellarigu. Dr. Ashok Kale Parshuram, born in Chiplan district, Ratnagiri. Dr. Ashok Kale graduated in MBBS from Pune University in the year 1973 and completed his MD in community medicine from Pune University in the year 2000. Dr. Ashok Kale has worked as medical officer in many health centers. He was also self-employed as clinical practitioner, and Dr. Ashok Kale is serving for some of the NGOs even today. Dr. Ashok Kale's success in modifying health policies are like this: anti-rabies vaccination by intradermal route, blood storage center in Drug and Cosmetic Act, zoonotic tuberculosis, Samudayic Dohale Bhojan, and Utsavan weaning program. Dr. Ashok Kale involved in some of the projects like investigation of epidemic of malnutrition in Melghat area, blood procurement practices in Dhule district, cesarean section rate in Pune city. Dr. Ashok Kale published around 16 journals related to the medical field. Dr. Ashok Kale contribution in social organizations are many. Founder member of Akhil Bhartiya Grahak Panchayat, ex-state secretary NMO Maharashtra, national conveyor Bhartiya Swasthya Chintan 2006 to 2013, founder member A2 Prasar Manch. Sir, it is our privilege to have you as a speaker in our ABGP Paakshika Karyakrama. Welcome to ABGP Karnataka Prant program and request you to take over the session, sir. Thank you.
नमस्ते. आप सब सुन पा रहे हो? Can you hear me all?
Yes, sir. Hear
Yes,
me,
sir, your
hearing
voice
sir.
is clear.
Yes, sir. Yes,
So
sir.
then
Here
I will
only.
continue. The subject of cesarean section, as usual, when my wife had a cesarean some 45 years, 50 years back, and that time I was compelled, though I was a doctor at that time, but when it comes to your personal condition, then you take everything very seriously, that whether Caesar should be performed or not. And at that time I was told, as usual, that the child, the fetus in utero, is in distress, and so there is no way that she can deliver normally with a live baby. And so I consented for the cesarean section. It was year 1979 in the remote place of Assam. Subsequently, after almost 5 to 6 years, when I returned back, on second delivery was due in the year 1984. Then I had started reading that what is the reason of why it is caused. And after going through much of a literature, since I was a Grahak Panchayat founder, I was always thinking with the angle of a consumer, common consumer. And I spoke to many obstetricians who were my friends, and they said there is not a mandatory condition that every previous Caesar woman should have a second Caesar. So we took a lot of efforts, and she delivered normally, even after first was a cesarean child. Then I started studying on that. It so happened in 1999, when Grahak Panchayat was having a silver jubilee function. At that time, we published a small souvenir, and in that souvenir, one article was made where we want to estimate what is the cesarean section rate in Pune. And it came out to be 37% in the year 1999. And the cesarean section rate of a repeat Caesar was 92%. Means out of 100 women who had a previous Caesar, 92% of the women will have to undergo Caesar. So we started thinking that this is the greatest of the epidemic for our country. And as per our Grahak Panchayat objective to have a Shoshan Mukta Bharat and Vyavastha Badal, there should be the arrangement or management should be altered in such a manner that it should become a consumer friendly. On those lines, I started working and I got an opportunity on the Golden Jubilee celebration at Mansar, Maharashtra, Jalgaon, and then at Hapud, Meerut. There I presented my viewpoint. In these 25 years, I have learned that like our Ma Saraswati as a goddess of education, Ma Lakshmi as a goddess of money or wealth, we have Lajja Gowri, a goddess of natural birth. And coincidentally, this Lajja Gowri temple are in Karnataka. So then I thought that let us have a Lajja Gowri campaign all over India. Now, why the doctors are forced to perform a cesarean? There is a understanding or a fake narrative that doctors are greedy, and so just for the sake of earning, they perform a Caesar when it is not indicated. Moreover, it was a narrative that our new generation of women, they don't want to bear down. They are fed up of breastfeeding and all the elements arising out of pregnancy. So they are also not keen on having a second or third delivery. I did not believe this, and so I started studying. And then I was shocked to know that the obstetric table, which is used almost 100% for the sake of labor or delivery, it itself is a defective structure. So I started learning that what is the defect in the table itself. A supine hypotensive syndrome was known or investigated or invented by Dr. Howard of Texas University in 1953. And he showed that a woman lying on the labor table in a supine position, means her back is resting on the table, her uterus, which weighs 10 kilo with 2-3 kilo baby, 2-3 kilo amniotic fluid, blood and placenta, that is pressing or compressing the vessels, biggest vessels, which are in English medical language is called as aorta and inferior vena cava. And this compression causes the child as well as the mother less of blood, and so mother gets asphyxiated, child also doesn't get sufficient blood due to the compression of the uterus on the blood vessels of body, and it results into a fetal distress. Now, most of the cesarean cause is supposed to be a fetal distress. So this fetal distress is nothing but a iatrogenic disease. Definition of iatrogenic disease is the disease caused due to the management and treatment of the patient. So this fits that lying down on a table is causing a condition prone for cesarean section. Now, other parts of the world, after year 1953, when they learned that the supine position and the labor table is disastrous for the laboring woman, they omitted that and they started using various techniques. There I learned that in India, all the women for thousands of years are having a natural birth because they take their labor pains in a standing position or a sitting position or a kneeling position or a left lateral position. So I went back to the government of India's rules for this this labor as a scheme. There I learned that in the year 2005, a Janani Suraksha Yojana was launched, and that Yojana contains that the Asha worker has to take the woman in labor to the one of the institute. Either it may be a sub-center, primary health centers, or a sub-divisional hospital or a district hospital. And there, you imagine when thousands of labor cases which were tackled at their home by DICE, when they started coming to the center, imagine what must be the number of patients for waiting for labor. So to dispose of all the cases speedily, they started performing this cesarean, because cesarean takes only 25 minutes, while a natural labor requires 6 to 7 hours. So while waiting for a natural labor for 5 hours, they can dispose 10 cases of labor only by cesarean. So this whole scheme seems to be that there is some mismanagement of before launching Janani Suraksha Yojana of institutional delivery in 2005. So now, what next is our problem? What next? We agree that lying on the supine position makes the cesarean condition favorable. We understand that there is no system of so many beds for natural delivery. The ANM and GNM courses, M stands for midwifery, but hardly any ANM student, even if she passes or he passes from his institute, gets an opportunity to make a delivery of a laboring woman. Only the name is midwife, auxiliary nurse midwife, or general nursing midwifery. So I went to many places in Maharashtra. There I came across that one center in Nandurbar district of the tribal area. There were 20 DICE were there, traditional birth attendants. And in that primary health center, they used to call the traditional birth attendant and perform a delivery. So instead of home delivery, institutional deliveries were performed in that Borat primary health center, but not with the help of nurses or doctors, but with the help of the traditional birth attendant. So I think this particular scheme of Borat primary health center fits into our Grahak Panchayat notion that we want to change the existing malfunctioning system of anything. Secondly, I learned, that is also very recently, that it was not only European or American and French doctors that they learned that this obstetric table of lying supine position is a culprit of the whole issue of a high rate of cesarean. So Indian doctors also have thought it, that there is something wrong with the pattern of table. So one doctor from Nanded, he is a postgraduate as well as he is a professor of obstetric gynec. He has come out with a table. It's not a table, a birthing chair. And that birthing chair suits the purpose that it doesn't make the uterus to compress the arteries or aorta or vena cava. So the child, the baby in utero doesn't get distressed. The mother is also comfortable. So there is an alternate to our existing table of obstetric table, which has a horizontal condition to lie down. But that horizontal table only women can appreciate, that it is so narrow, so high, like a top berth in any railway compartment. So she cannot turn on when she lies down on the table. She cannot turn. She cannot get down from the table independently. Now, in 2016, a change has occurred in our policy in Government of India, that usually the lady who is in labor pains, she is only permitted in the labor room, and all her relatives are driven out. That the whole relatives, they stand outside, and this only lady goes in where all the staff of the labor room is there. So making a change, government has permitted a birth companion to accompany the laboring woman whole period of labor. So this new change is on paper only. It hasn't percolated in any of the nursing home as far as I have experience. It might be few nursing homes may be allowing the birth companion, but the woman, pregnant woman, doesn't know that she has been given this particular authority or right to take her friend who's a birth companion to accompany her in the full process of labor. Second change which has come out after our new government came out in the year 2014, that a woman in a labor room was ill-treated by the other ladies who are a staff of the labor room. They used to abuse, use bad words, they used to slap. She was taken like a gulam, a slave. And this particular behavior needs a change. So they came out with a condition called as respectful maternity care. So that flex has to be displayed in the labor room, that for anything you perform to the woman, you can ask her to lie down. You have to take her permission and consent. If you want to start a pitocin drip, you have to take her consent. If you want to perform a vaginal examination, you need to tell that I am doing this, and whether shall I do it. So this respectful maternity care and this birth companion, these are the two changes which has not percolated down. So I thought that if you want to aware the pregnant woman on a large scale, let us have what we call Simantonayan program in various places, where all the women who are pregnant, they and their relatives will assemble. We'll have a cultural program, and in the cultural program, you can tell that the new changes have taken place, like birth companion. You can tell that you have got full authority to accept or reject every proposal which they give you during that particular period. So if we make this particular Samudayik Godh Bharai in Hindi, Marathi Samudayik Dohale Jevan, and in your Karnataka language, Samudayik or community Simantonayan, then we have a audience of those who really need the knowledge of how changes have taken place and why she goes into the stage of labor. So these all changes should be brought all over India, in every district, in every taluka. And when we do it on a large scale, on a mass scale, not large, on a mass scale, then only we will see the changes in the cesarean section rate all over India. Because every year, 3 crore births are taking place in India. We have known that hardly 10% women, that is out of 100 women who deliver, 10 need real true cesarean section aid, while 90% should deliver normally. So we take it that when the cesarean section rate depends on the financial condition of the woman and the financial condition of the state, we have seen that India has been divided in 5 sectors. A recent article, which is yet to be published in January 2025, they have divided India into 5 zones depending on the cesarean section rate. So I think out of all the organization, Grahak Panchayat is a proper organization because these our objective is to make a vyavastha badal, change the management or system of anything and avoid the Shoshan, what we call Shoshan Mukta Samaj. This is a great Shoshan. Now I will add few things for you that this caesarean not only results more expenditure, but the life of the child in utero and subsequent child who is yet of the second occasion, third occasion, it also gets damaged because of caesarean scar on her his mother this thing, uterus. The child doesn't get the necessary beneficial bacteria because the child is not passing through the natural tract of vagina. So it has been studied in other countries, as well as in India, that the rate of asthma, the rate of diarrhea, the rate of malnutrition, they are more in the child if it is a Caesar child. Second baby with a previous scar on his mother's abdomen also gets a problem of various diseases. Now I will go one more thing I will add to it, that this supine position in during the labor not only affects the fetus in utero at the time of labor, but if the lady is lying supine position in her third trimester, that is 35 to 40 weeks of gestation, the child in utero has more chances of stillbirth. The child may die in utero. Second, the child weight gain is also less because the mother whole night she is lying on the supine position. So what we call IUGR, intrauterine growth retardation. And third is low birth weight babies are born in mothers who during their third trimester of pregnancy or during pregnancy, they are habituated to sleep on the supine condition. So these all things have never come out because there is a department in every state as well as in India which is called as Mother and Child Welfare, and under that department, Mother and Child Welfare, Anganwadi workers are running the Anganwadis in every village. They take care of the mother as well as child, but this particular angle, that why the child is malnourished, because his mother was lying in a supine position during last few weeks of pregnancy, why the child is IUGR, why the child is some other defects, more asthma, more diarrhea cases, because the child hasn't experienced the passage of vagina of mother. So these all things we can contact the Mother and Child Welfare Department of each and every state government and explain them, because they are non-medicals. CDPO or the minister, they are not medicos. They don't know that these all things can happen only because of lying supine position on the bed. So if we tell them, then they may pass it on to the Anganwadi workers, and then Anganwadi workers make awareness, generate awareness in the woman that you have a right of birth companion, you have a right of getting a respectful maternity care. If you sleep on the supine position during last few weeks of pregnancy, your child will get a less weight because of less blood supply to the baby. The child growth will be hampered. Then the child may have a die also because of lying down for a prolonged period, 8 hours daily during the night hours or day hours. So if we bring this particular science of stillbirth, science of IUGR, science of low birth weight babies, science of cesarean, and the root cause is the posture of while in pregnancy as well as while delivery, then they may suggest this whole change will occur, because there are in every 1,000 population, they have one Anganwadi. Imagine what means the condition in India. In each and every taluka, in each and every village, this message, we have workers. So this is in short, I think, this Lajja Gowri Mohim, which I have made a small diagram and small presentation during my Hapud or Merit when we celebrated our 50th Golden Jubilee year in 2 months back on the 20 and 21st October. There I had shown one small 13 minutes film which was telling all the things related to high cesarean section rate and what pregnant woman should behave during her pregnancy as well as during childbirth. This film I had shown, and a PowerPoint presentation was shown. I now request our Gayatri Didi to display that PowerPoint presentation so that I'll be able to explain each slide, and that will be a repetition, but that will be audio visual, because now you are just listening me. But if you see the image or each point PowerPoint slide, you may get more knowledge after, because visual also impact will be there. So I request you, there are many things can be added to this, because in 2002 we made a change in changing the blood transfusion policy in India. And there I experienced that how blood banking people, they opposed it because they had a conflict of interest. So we should take into consideration there is a conflict of interest. Now, first slide you can see on the screen. Next. Now, next slide. Yes, this is a Lajja Gowri Ma, which is shown in a standing posture, and the head of the baby is coming out. This is the proper position for natural birth in all over world, but in India it is called as Lajja Gowri Ma. In Karnataka temple is there. Next. Now this is a Anganwadi. You can see a board behind and some 10 women with wearing the all ornaments. And we had organized this Samudaik Simantonayan in your language. In Hindi it is called as Samudaik God Bharai. In Marathi it is called as Dohalejan. So in Anganwadi we had done it in the year 1992. You can imagine, almost 30 years back we had done this. Next. Now, in Pune, in a city, with the help of Anganwadi workers, we had got this particular function in the year 1999, where 33 women had come, all ANC cases, and these all ANC cases were brought by the 5 to 6 Anganwadi in that Dhankaudi area of Pune city. And this is that handbill which I am showing you, that all the Mahila Mandal, all the Anganwadi workers, they had called all the women for this particular activity of Samudayak Dohale Bhojan. And the nursing college people also had joined. Now this is the photograph of a lady who is pregnant, and we take this photograph of every lady individually and we paste it on the ANC card of the woman, because the ANC card are prepared with giving details of blood pressure, height, all complaints, but they are not retained. So if you paste the photograph of the lady on the ANC card, antenatal card, it is preserved. Now this is a photograph where 33 women, next. This is the flex. These 33 women you can see, usko गोद भराई कह रहे हैं. They, we used to give iron with calcium tablets. 33 गर्भवती महिला, 33 antenatal cases had attended that Samudayak Dohale Bhojan in the year 1999, organized by Grahak Panchayat, Akhil Bhartiya Grahak Panchayat Pune. Next. This is that slogan, if you can flex. Akhil Bhartiya Grahak Panchayat Naisargik Prasuti Jagaran Abhiyaan. And it was a Mahila Medava. So we had done it, many activities in the year 1999 at our Silver Jubilee function of Grahak Panchayat in Pune and other parts of Maharashtra also. Next. Now this table is a modification of the existing table. You can see there is a inverted U bar is there, which is fitted on the existing obstetric table. There is a stand. She can support it. She need not lie down. The backrest is there in a 90 degree or 135 degree position. Now, how this bar is used for taking labor pains, that will be seen. We call this as a Lajja Gowri bar. Next. Next. See, this laboring woman. Next. Let the... See, this laboring woman is holding the bar with her hand and taking labor pains. Her back hasn't touched the surface. Her buttocks are also in air. Buttocks are also not fixed. She is just putting her sole, that is feet, and on the table, but whole body is in the air. So when the child tries to come out through the passage of pelvis, the child makes a movement, and we think the lady is making movement. Lady is not making movement. Child is coming to the tortuous road of pelvic outlet. And so this bar is useful. This bar is not seen in any table. So this is our total innovation of Grahak Panchayat, that you add a inverted bar, inverted U bar, so that the lady will be able to hold, and without resting her back or buttocks on the table surface, she can take the labor pains, and she will deliver normally, vaginally. Now, next. Now, this is we are talking to the dye system of thousands of years. Now, this dye system has been abolished due to Jani Suraksha Yojana launched in 2009. But what we should go for it, that let the delivery be in institution, because dyes are not very habituated of hygienic practices, or because they are illiterate, they are old. But if suppose we start paying the dye for every delivery she comes and conducts in the primary health center or a sub-divisional hospital of a taluka, like I told you in Nandurbar they are doing, let government pay her 3,000 rupees, 4,000 rupees per case, so that if she starts earning 20,000 by performing 5 to 6 deliveries, then her own daughter, granddaughter, her sister, her daughter-in-law, they will be eager to get the art of delivering, because they are now agreeing to it, because they say, what is the use of having the art of delivery, because they are not getting any money return out of it. So once the old lady starts earning 20,000 rupees, other family members will also take up the skill of performing normal delivery through the dye. And so whatever the parampara of dye is now abolished or broken, that will be reinstituted all over India. So we will get thousands of dyes. These dyes can be made birth companion, because they are not averse to the feces, urine, blood, which is seen in the labor room. All other women, they are not used, because all the three natural outlets of human body, that is anus, urethra and vagina, are very close to each other. And during labor, all the three start shedding their feces as well as urine. So common lady, she doesn't like all these dirty things. But a dye knows she can withstand that all, she can help. So let us use dye as a birth companion and give independently charges of birth companion to her. And so let us reinstitute the dye system which existed all over India for thousands of years. Next. Now, there is a Gujarat Dye Sangathan is there. Now, accepted Caesar section all over world is 10 to 15% only. Next. These are the different positions. You can see on the this thing slide. These are the different positions which the lady can take when she is in labor room, and these all positions will be helpful for a natural delivery. You can see she is putting her leg on a table. She is holding a companion, hugging the companion. She is holding a rope, or she is sitting. All these situations, these all finally lead to natural, normal birth without cesarean. Next. Next. This is in 2018, Government of India, in order to reduce the cesarean section rate, they had come out with a proposal which is called as Midwifery Initiative 2018 by National Health Mission. But since 2018 and now 2024, 6 years, nothing has gone ahead of it. Why? Because when I studied it, myself and Vijay Sagar, we met many nursing college principals as well as the administrators, and then we learnt that they are not willing to get the activity of midwifery, only because there are almost 20 lakhs shortage of nurses are there. Nurses are required not only for labor, for surgery, for orthopedic, for pediatric, for medicine. Everywhere you require nurses. The nurses are so much in short that they don't have surplus nurses who can take up this midwifery initiative. So the scheme hasn't gone ahead. So we thought that now there is a time to make a change, revamp or reform the existing scheme of Jani Suraksha Yojana, which was launched in 2005, making it Jani Suraksha Yojana 2, or revamped Jani Suraksha Yojana, where the dais will be entertained as birth companion. They will be invited to attend the institution. Let us they continue the institutional delivery pattern. We need not go back to home delivery. We can accept the institutional delivery pattern of Jani Suraksha Yojana. So this modification, but don't try to use midwifery initiative, taking the A&M, BSc nursing graduates or GNM for lowering the cesarean section. In 7 years, Government of India has seen in none of the state the issue or the scheme has stepped a single step also. Because there is an acute shortage of nurses already. So they don't have surplus nurses for putting them in nursing midwifery initiative of 2018. So this revamped scheme of Jani Suraksha Yojana will really lead to lowering of cesarean section. Let Anganwadi workers organize this Samudayik Godh Bharai or in their own premises. In the last 4 weeks of pregnancy, let the woman attend the Anganwadi and make some movements, make some activities, so that her pelvic girdle will become loose, because her lifestyle has changed. Now she is no more washing clothes by sitting down on the earth. She is no more washing her utensils. She is no more cooking on the by sitting down. So her pelvic girdle is almost has become a fixed one. It is not flexible. So improve the flexibility of the pelvic girdle during the last 4 weeks. Let the Anganwadi premises be used in the afternoon hours, because Anganwadi run only during the morning hours. Afternoon hours, those area, those premises, those buildings, those one room Anganwadi can be used for women who are pregnant, and let them come, let them play, let them discuss, let them share their views, let them earn, we can keep some books there or some videos, so they will learn that what are their rights and how normal delivery can take place if she exercises daily by attending the Anganwadi. So this is what I think that Government of India and Mother and Child Welfare Department should be approached in every state or in every district and give this. Now coming to foreign. Now, as I told you, in 1953 they came out that there is one supine syndrome had hypertension syndrome. So they are no more asking the woman to lie down on the table in any of the Western countries. Now the delivery is taking place in a water tub, because in water tub you can't lie down. You will drown yourself. So this is what is going on in other parts of the world. Next. Now, this is a group photo when I went to Chhattisgarh for my personal work. There, all the Grahak Panchayat people, they came. I delivered them. So it was the first occasion in Chhattisgarh that I went, because they knew that I am a Grahak Panchayat member, because I had worked in 2007 to 9 in Jagdalpur, that is Chhattisgarh area. So they knew me well. So after almost 15 years, I went back to Chhattisgarh for a 2 days trip. There all they assembled, and I showed that what Lajja Gowri Mohim can be started. Next. Now this is the lecture which I delivered. The second is in Chhattisgarh only, Raipur. From Maharashtra, from Pune, I went to Raipur. Now this is a big ball. It is called as birthing ball. The lady is made to sit on the birthing ball. The ball is so much unstable that just to keep her balance, she moves her body. And that is what we wanted, that her pelvic outlet or pelvic girdle should be lax or move. So this birthing ball is there, where she is made to take labor pains, and during last few weeks of pregnancy also she can sit and take this ball can be kept in any Anganwadi. So the ladies will enjoy. Some 4-5 balls are there. Everybody will sit and they laugh at each other how they are losing balance. So this some other things are also there, but this I could not make in this PowerPoint, because this I presented in the Hapud. In last 2 months, so many changes have taken place in my views, but I could not make it changes. Next. This is a position for taking labor pains. Next. So what should be done? She should not, under any pressure, the birthing, laboring woman should lie down for more than 3 minutes. For a vaginal examination or for recording the fetal heart rate, 2 minutes are enough. No need to continuously put that fetal monitoring device on her abdomen and make her lie down continuously on the table. She should say, 1 minute or 2 minutes you can record. Every half an hour I will come and lie down on the table. And this should be, she should ask that I have been authorized to respectful maternity care. So I will not lie down continuously on the table. Because she knows that if she lies down continuously, there will be a condition for making Caesar. Next. Now, what happens because of she lies down on the table? This is a point that what happens, that there is no gravity force for facilitating the descent of the baby down. Then there is a fetal anoxia is there, and she cannot be comfortable. She cannot talk to the people for looking at the ceiling of the room is so obnoxious. So if she sits, she has got many of the benefits are there. These are all benefits are mentioned in this particular slide, that the slowing of the labor progress is also due to lying down. Then the pain intensity is also very weak. She gets less blood. So all these are the disadvantages of lying down on the bed. This slide is telling all that. What are the disadvantages? Next. Thanks a lot. That is the end of my presentation, which I made in Hapud. I thank the organizer of today's Google Meet, giving me an opportunity and inviting all others for this particular Google Meet, which is the first of the Google Meet in our Bharat. And initiative has been taken by a state which has got Lajja Gowri temple. So I thank everyone. Thank you very much.
Thank you, sir. Your session was so informative, and we got more exposure about our the term we heard the Lajja Gowri, but we were not knowing this much of information about it. I request Dr. Varsha Padya, ABGP Jilla President, Raichuru Jilla, uh, to give
Sangeeta,
the word of.
Sangeeta, one ನಿಮಿಷ.
Okay, one.
ದೇವಿ
Oh, sorry. If you have any questions, please raise your hand, or you can text in the text box also. Dr. P. Shetty has raised his hand. Sir, could you please unmute your microphone?
Yeah, good evening, everybody. I'm Devi Prasad Shetty here. Dr. Ashok sir, now we have discussed various points about the good things about in the standing position of this labor. Now, I want to ask you one doubt. Suppose if there is any problem with the umbilical with the umbilical cord, how this can be managed if the delivery is taking place in a house?
No, I am not proposing home delivery. Moreover, secondly, the umbilical cord around the neck, we feel that it is something very abnormal. It is not abnormal. That umbilical cord is almost 3 to 4 feet long. So as it goes around, it also changes its position, becomes other position also. So no need to worry. If it is not tight around the neck, then only there is a problem. Otherwise, if it is a loose, because it is full of water is there, the child is swimming almost in a 3 liter of water. So it is not a stationary position there. Full hours during the labor, the cord around the neck will be there, and cord is not compressed because it is not tight around the neck of the baby.
Okay, severe vaginal bleedings will be there, and if that is the case, now still it can retain, sir.
Pardon, I couldn't get you.
Sir, severe vaginal bleeding is there.
Huh.
Okay, in that position, it will be all right if the umbilical cord is creating a new problem.
Yes, there are ways of tackling that issue, but on most than 95% of the occasions, let us concentrate more on 95%, because in that case, cesarean is permitted. We don't say that there should be zero Caesar. We say that some conditions where out of 100, 10 Caesars are valid. So in such case, cesarean, we don't say that don't do Caesar, even if the child dies, even if the mother faces problem, don't do Caesar. We are not we are not extremist. We accept that the acceptance cesarean section rate is 10%. So for those cases, as you said, we can go for Caesar.
Okay. Okay, thank you, sir.
You can take down my number. All of you, I will just tell you, you can take down my number, and then anytime you can ask me, question me, you can share that number to any of the pregnant lady or their relatives. And I am very much keen to answer, give a reply, or make, as far as my condition goes, I will try to satisfy their query.
Yes, I will do right now.
ನಾ ಕನ್ನಡದಲ್ಲಿ ಹೇಳಿದ್ರೆ ಆಗ್ತದ? ನಾನು ಹಿಂದಿಗೆ ತಯಾರಾಗಿಲ್ಲ. ಅಲ್ಲ, ಟೈಮ್ ಇದೆಯಮ್ಮ? ಟೈಮ್ ಇದ್ರೆ ಸರಿ. ಸರಿ. ಹ. ನಮಸ್ತೆ, ನಾನು ವಿಜಯ ಅಂತ ಹೇಳಿ 42 ವರ್ಷದಿಂದ ಸೇವಿಕಾ ಸಮಿತಿ ಕಾರ್ಯಕರ್ತೆ. ನನಗೂ ಡಾಕ್ಟರ್ ಜಿ ಅವ್ರಿಗೆ ಆದ ಹಾಗೆ ಒಂದೆರಡು ಅನುಭವಗಳಾಯ್ತು. ಹಾಗಾಗಿ ನಾನು ಗರ್ಭದಲ್ಲಿ ಕೊಡೋ ಸಂಸ್ಕಾರ ಎಷ್ಟು ಮುಖ್ಯ, ಅದಕ್ಕೆ ಹೇಗೆ ಕೊಡ್ಬೋದು ಅನ್ನೋದನ್ನ ಸ್ವಲ್ಪ ನಾನು ಸ್ವಂತವಾಗಿ ಅಲ್ಲಿ ಇಲ್ಲಿ ಕೇಳಿದ್ದಂಥದನ್ನ ಪ್ರಯತ್ನ ಮಾಡ್ತಾ ಇದ್ದೆ 25 ವರ್ಷಗಳಿಂದ. ಅದಾದ ನಂತರ ಅಧಿಜನನ ಶಾಸ್ತ್ರ ಅಂತ ಹೇಳಿ ಗುಜರಾತ್ ಇಂದ ಹಿಂದಿನಲ್ಲಿ ಮಾಡಿರುವಂತ ರಿಸರ್ಚ್ ಮೆಟೀರಿಯಲ್ ಬುಕ್ ನಂಗೆ ಸಿಕ್ತು. ಅದರ ಮೂಲಕ ಈಗ ಸಂಘದಲ್ಲೂ ವ್ಯಾಪಕವಾಗಿ ಗರ್ಭ ಸಂಸ್ಕಾರದ್ದು ನಡೀತಾ ಇದೆ, ಬೇರೆ ಬೇರೆ ರೀತಿನಲ್ಲಿ ಮಾಡ್ತಿದ್ದಾರೆ. ನಾನಂದ್ರೆ ಆನ್ಲೈನ್ ಅಲ್ಲಿ ಮತ್ತೆ ಗರ್ಭಿಣಿಯರು ಗರ್ಭಪೂರ್ವ ತಯಾರಿ ಇದಕ್ಕೆಲ್ಲಾನು ನಾನು ಮಹಿಳೆಯರು ಸೇರಿದ ಕಡೆ ಹೋಗಿ ಅಲ್ಲಿ ಮಾಡುವಂಥದ್ದು, ಸೇರಿಸಿ ಮಾಡುವಂಥದ್ದು ಮಾಡ್ತಾ ಇದ್ದೀನಿ. ಟಿಪ್ಸ್ ಕೊಡೋ ಕಾರ್ಯ, ಗರ್ಭಪೂರ್ವ ಹೇಗೆ ನಮ್ಮ ಜೀವನ ಶೈಲಿ ಇರಬೇಕು, ಯಾತಕ್ಕಾಗಿ ವಿವಾಹ, ವೈಯಕ್ತಿಕ ಕಲ್ಪನೆ ನಮ್ಮ ಭಾರತದಲ್ಲಿ ನಮ್ಮ ಧರ್ಮದಲ್ಲಿ ಇರ್ಲಿಲ್ಲ, ಸಮಾಜದ ಉತ್ತಮ ಸಮಾಜಕ್ಕಾಗಿ ನಾವು ವಿವಾಹ ಆಗ್ತಾ ಇದ್ದಿದ್ದಂಥದ್ದು, ಇದನ್ನೆಲ್ಲ ಸ್ವಲ್ಪ ಬೇಸಿಕಲಿ ಕೊಟ್ಟವ್ರಿಗೆ ಅದಕ್ಕೆ ಮಾನಸಿಕ ತಯಾರಿ ಮಾಡಿ ಯಾವ ದಿವಸ ಅವರು ಗರ್ಭಧರಿಸಕ್ಕಾಗಿ ಸೇರಬೇಕು ಪತಿ ಪತ್ನಿ ಯಾವ ಸಮಯದಲ್ಲಿ, ಈ ತರದ್ದೆಲ್ಲ ಮೊದಲು ಹೇಳಿ, ಆ ನಂತರ ಮೊದಲನೇ ತಿಂಗಳಿಂದ ಡೆಲಿವರಿ ಆಗೋ ತನಕ ಹೇಗೆ ಅವರು ಜೀವನನ ಇಟ್ಕೋಬೇಕು, ಮಗುಗೆ ಹೇಗೆ ಒಂದು ಸೂಚನೆಯನ್ನ ಕೊಡ್ತಾ ಹೋಗ್ಬೇಕು, ತಂದೆ ತಾಯಿ ಗರ್ಭಧರಿಸಿದಂತ ತಾಯಿ ಇರ್ಬೋದು, ಅವ್ರ ಮನೇಲಿರೋ ಅನ್ಯ ವ್ಯಕ್ತಿಗಳು ಅಜ್ಜಿ ತಾತ ಆ ತರ ಅತ್ತೆ ಮಾಮ ಚಿಕ್ಕಪ್ಪ ಚಿಕ್ಕಮ್ಮ ಇವರೆಲ್ರು ಅದಕ್ಕಾಗಿ ಹೇಗೆ ಕೊಡ್ಬೇಕು ತಯಾರಿನ, ಈ ತರದ್ದೆಲ್ಲ ಒಂದೊಂದು ಸಣ್ಣ ಸಣ್ಣದಾಗಿ ಹೇಳ್ತೀನಿ. ಆಹಾರದ್ದು ಹೇಳ್ತೀನಿ. ಹಾಗೆ ಗರ್ಭ ತರಿಸೋದಕ್ಕೂ ಮೊದಲು ನಮ್ಮ ದೇಶಕ್ಕಾಗಿ ನಮ್ಮ ಕುಟುಂಬಕ್ಕಾಗಿ ಉತ್ತಮ ಆತ್ಮವನ್ನ ಕಳಿಸು ಭಗವಂತ ಅಂತ ಭಗವಂತನಲ್ಲಿ ಪ್ರಾರ್ಥನೆ ಮಾಡಿಕೊಂಡು ನಾವು ಪೂರ್ಣ ತಯಾರಿಯಾಗಿ ದೈಹಿಕವಾಗಿ ಮಾನಸಿಕವಾಗಿ ತಯಾರಿ ಮಾಡ್ಕೋಬೇಕಾಗುತ್ತೆ. ಪರಿಶುದ್ಧವಾಗಿ ಇರ್ಬೇಕಾಗುತ್ತೆ ದೈಹಿಕವಾಗಿ ಮಾನಸಿಕವಾಗಿ ಅಂತ ಅವ್ರಿಗೆ ಅದ್ರದ್ದೆಲ್ಲ ಟಿಪ್ಸ್ಗಳು ಕೊಟ್ಟು, ಆ ನಂತರ ಅವರು ದೈಹಿಕ ಸಂಪರ್ಕ ಮಾಡಿ ಹೇಳಿದಂತ ಸಮಯಗಳಲ್ಲಿ ದೈಹಿಕ ಸಂಪರ್ಕ ಮಾಡಿದಾಗ ಅದು ಉತ್ತಮ ಸಮಾಜಕ್ಕೆ ಆಗುವಂತಹ ಶಿಶು ಜನಿಸಕ್ಕೆ ಖಂಡಿತ ಸಾಧ್ಯ ಇದೆ. ಅದಕ್ಕಾಗಿ ಕೆಲವೊಂದು ಉದಾಹರಣೆಗಳು ಕೂಡ ನಾ ಹೇಳ್ತೀನಿ. ಈ ತರ ಕಾರ್ಯ ಮಾಡ್ತಾ ಇದೆ. ಅದನ್ನ ತಾವ್ ಯಾರು ಬೇಕಾದ್ರೂ ಯಾವಾಗ ಬೇಕಾದ್ರೂ ನನಗೆ ಕೇಳಿ ಬಳಸ್ಕೋಬಹುದು. ಇದಿಷ್ಟು ಮಾಡ್ತಾ ಇದೆ. ಇನ್ನು ಮುಂದೆ ನಾನು ಈ ಲಜ್ಜಾ ಗೌರಿದನು ಇದಕ್ಕೆ ಸೇರಿಸ್ಕೊಂಡು ಮಾಡ್ತೀನಿ. ತುಂಬಾ ಕಡೆ ಮಾಡ್ತೀನಿ, ಬಹಳಷ್ಟು ಕಡೆ ನಾನೇ ಹುಡ್ಕೊಂಡು ಹೋಗಿ ಈ ಕಾರ್ಯಕ್ರಮ ಮಾಡ್ತೀನಿ, ಬನ್ನಿ ಎಲ್ರು ಕೇಳಿ ಅಂತ. ಕೇವಲ ದಂಪತಿಗಳಿಗೆ ಮಾತ್ರ ಅಲ್ಲ, ಹಿರಿಯರಿಗೂ ಹೇಳ್ತೀನಿ. ಯಾಕೆಂದ್ರೆ ಅವ್ರಗಳ ಮೂಲಕ ಹೊಸ ದಂಪತಿಗಳಿಗೆ ಇರ್ಬೋದು, ಬೇರೆಯವ್ರಿಗೆ ಅವ್ರು ಹೇಳಕ್ಕೆ ಸಾಧ್ಯ ಆಗ್ತದೆ. ಈಗ ಅವ್ರು ಹೇಳಿದಾಗೆ ಅಜ್ಜಿದಿರು ಈಗ ಎಲ್ಲ ಟಿವಿ ಮುಂದೆ ಇರೋದ್ರಿಂದ ಮಕ್ಕಳಿಗೆ ಕೊಡುವಂತ ಸಂಸ್ಕಾರಗಳು ಬಹಳ ಕಡಿಮೆ ಆಗ್ಬಿಟ್ಟಿದೆ. ಅದಕ್ಕಾಗಿ ಅಜ್ಜಿದಿರಿಗೆ ತಾಯಂದಿರಿಗೆ ಮೊದಲು ಸಂಸ್ಕಾರ ಸಿಕ್ಕರೆ ಮಕ್ಳಿಗೂ ಕೊಡೋಕೆ ಸಾಧ್ಯ ಆಗ್ತದೆ ಅಂತ ಹೇಳಿ ಎಲ್ರನ್ನೂ ಸೇರಿಸ್ಕೊಂಡು ಮಾಡ್ತಾ ಇರೋಂಥದ್ದು ನಾನು. ಅದಕ್ಕಾಗಿ ನಾನು ಇದನ್ನ ಮತ್ತೆ ಲಜ್ಜಾ ಗೌರಿನೂ ಸೇರಿಸ್ಕೊಂಡು ಹೊಸ ವಿಷಯ ಇದು ಹಳೆ ವಿಷಯ, ಆದ್ರೆ ನನಗೆ ಹೊಸ ವಿಷಯ. ಇದನ್ನ ಸೇರಿಸ್ಕೊಂಡು ನಾನು ಮುಂದಕ್ಕೆ ಮಾಡ್ತಾ ಹೋಗ್ತೀನಿ. ಸಾಧ್ಯ ಆದಷ್ಟು ನಮ್ಮ ಸಮಾಜ, ನಮ್ಮ ದೇಶ, ನಮ್ಮ ಧರ್ಮವನ್ನ ನಾವು ಶುದ್ಧವಾಗಿ ಇಟ್ಕೊಳ್ಳಕ್ಕೆ ಪ್ರಯತ್ನ ಪಡೋ ನಿಟ್ಟಿನಲ್ಲಿ ನಾನು ಈ ಕೆಲಸನ ಮಾಡ್ತಾ ಹೋಗ್ತೀನಿ ಅಂತ ಹೇಳಕ್ ಇಷ್ಟಪಡ್ತೀನಿ. ಧನ್ಯವಾದ.
Yeah, I'm here. If anyone is having any questions, please raise your hand. I have already texted the Dr. Ashok Kale sir number. So again, I will retext the number. If you have any question right now, you can raise your hand.
Samita, good evening, namaste. I
Please
myself
raise your hand
Vasundhara,
before
assistant.
unmuting your. Yes, Vasundhara Patil, please speak up.
Yeah. Uh, Thank you, madam. Thank you. Thank you. Namaste. Actually, there is no question, but it's a wonderful presentation. Wholeheartedly, I express heartfelt thanks to Dr. Ashok Kale sir. But मुझे एक ये आ रहा है कि इतना scientific that is the procedures are there. Why the medical institutions not using these type of instruments, tables and all? Uh, you can suggest the committee and because the table which you are suggested is nowhere find in the any institution, sir. Wonderful suggestion and also the Garbha Samskara and all. It's a meaningful session, sir. Thank you one and all giving me opportunity for express my few words. Thank you so much.
Shall I give one small 5 minutes answer to this particular question?
Yes, sir,
Sure, sir.
please.
Huh. When in year 2002, that is 22 years back, I was pressing on behalf of Grahak Panchayat that why in a rabies vaccine we are not giving intradermally and we are trying for only intramuscular route, which requires 5 ampoules of 400 rupees each, costing 2000 rupees. And it could be only 400 rupees will suffice. 1 ampule will suffice at the place of 5 ampoules. Now, this particular intradermal administration of anti-rabies vaccine was practiced in Thailand since 1984. Imagine, almost 22 years all over world, few countries were using intradermal anti-rabies vaccine to human being only. But our Ministry of Health and Family Welfare, state and central level, they were not agreeing to my point that why intradermal route should not be started. Someone told me if they give intramuscular anti-rabies vaccine, the sale of the company will be 2000 crore rupees per year. And if they accept intradermal route, the sale will come down to 400 crores. So every year, losing 1600 crore rupees is not a good proposal for any of the vaccine manufacturers. So they used to bribe all the government officials with 1 crore each. So even if they spend some 400 crore rupees just for bribing, so that this intradermal route should not be there in India. So it forced Grahak Panchayat to make a public interest litigation in Mumbai High Court. And then this High Court judge summoned all the authorities, Government of India, Government of Maharashtra and Pune Municipal Corporation, and give an explanation why intradermal route is not being practiced in your own places. They had no other choice than saying yes, we'll review. And within 6 months, the acceptance came. And now all over India, intradermal route is anti-rabies vaccine is practiced. So there also people said, if it is so useful, and when Thailand is using, the schedule is called as TRC, Thailand Rabies Route. So India is such a country that people also cannot believe that when it is something very clear cut. सूर्य प्रकाशा इतना सब साफ होते हुए भी उनको सूरज क्यों नहीं दिखता है, इतना सीधा सीधा बात होकर भी? Because there are vested interests. People are not bold. Those who think that this should start, they think my own community people. Like, I'm not blaming anyone, but understand, these are so only Britishers, only with 1,000 Britishers were ruling India for 150 years. Why? Imagine, same mindset is there. That अपना क्या जाता है, मेरा क्या जाता है, जाने दो ना. Who will take efforts to change the system? But Grahak Panchayat spirit, I took the lead on behalf of Grahak Panchayat, and anti-rabies vaccine was started. This second, that in 100 square feet area, blood storage center were initiated after 6 years of fight with all the authorities all over India. And then finally in 2001, this concept of blood storage center was accepted. So same thing is there, that our mindset, we are slaves of whatever is happening. We don't want to change. And who will take the lead? Who will bail the cat? If you try to bail the cat will consume you. So with that fear only, there are hundreds of things are there in medical practice which are irrational, illogical, unscientific. Still they are continuing all over India. Now, tackling one, you require a strength of people. Now, we have Akhil Bhartiya Grahak Panchayat. So, I am sure with the help of Akhil Bhartiya Grahak Panchayat, we can change this situation. And within 5 years, coming 5 years, the seizure rate will go down. Like, after midnight, you have a sunrise in the morning hours. The whole darkness vanishes. So this cesarean section rate will come down to 20-30 if we all take joint efforts. Don't think that why obstetricians are not accepting it, because they have got a very strong organization. They know supine hypotension syndrome. If you search, a Google search you make supine hypotension syndrome, and you will get the a lecture as well as the image of the human body, how it presses the aorta and inferior vena cava, what changes occurs in the fetal heart rate, how the mother gets exhausted. Everything is there, or clear cut. It is nothing a secret science. It is nothing a secret science. It is all hundreds of YouTubes are there. Hundreds of articles are there. So let us make a determined effort to bring down this cesarean section rate from the state of Karnataka, the homeland of Ma Lajja Gowri.
Thank you, sir. Thank you for your consent, and thank you so much.
Sir. I would call up Dr. Vasha Padya, ABGP Jilla President, Raichuru Jilla, for word of thanks.
Thank you, Sanhita ji. Bharat Mata ko namana. Good evening, all the Karyakartas of ABGP and the audience. Namaste. Today it was a second online meet of Grahak Paakshika by Karnataka Pranta. So we are very much thankful to Dr. Ashok ji, who is a pioneer of this Lajja Gowri Abhiyaan in India. He has explained it in detail, the problems women in labor is facing, and he has explained it at the scientific level, at the community level, personal level, even the patient's emotional and physical level. So it was a good information, and it was a new information for all the common people, common Grahak we say. So we assure you, sir, that through ABGP Karnataka, we'll take forward this Lajja Gowri Abhiyaan and spread the word and help to make it a nationwide movement on a mass scale. What Ashok ji had said, actually, I also didn't know the respectful maternity care, birth companion, etc. So the steps he has suggested, we will come back to you, sir, time and again, and we'll take your help in spreading the word and in Lajja Gowri Abhiyaan. So thank you again. Thank you once again, sir. Actually, in a recent last month only, in recent incidences of maternal deaths in Bellary, so we were very much concerned, and sir asked us, sir called Karnataka members, and he also called me, and he had told about Lajja Gowri Abhiyaan, and we are going to take up that Bellary maternal deaths. We are looking into it, and we are going to submit the report why it happened. Even recently in Kalburgi, there was a death of a patient in after C-section. So thank you, Ashok Kaleji. It was a great pleasure to have a founder member of Akhil Bhartiya Grahak Panchayat amongst us today. थैंक यू वंस अगेन, धन्यवाद आपको, और आप सभी को धन्यवाद, आयोजक है उनको सभी को भी धन्यवाद, संहिता जी और उनकी टीम, और जो श्रोता है उन्होंने भी अच्छी तरह से सुन लिया, बहुत अच्छे सवाल पूछे, तो आप सभी को धन्यवाद और शुभ रात्रि।
Namaste.
Thank you, Dr. Varsha Padyako. So we have reached the end of the session. We will end the session with Shanti Mantra. I request everyone to join for the Shanti Mantra. Om Sarve Bhavantu Sukhinah Sarve Santu Niramaya Sarve Bhadrani Pashyantu Ma Kaschit Dukkha Bhag Bhavet. Om Shanti Shanti
शांति शांति।
धन्यवाद।
Thank you.
धन्यवाद सभी को, धन्यवाद।
धन्यवाद, शुभ रात्रि, जय ग्रहण।
धन्यवाद सभी को।
रात्रि। Thank you. Thank you, one and all. Thank you, sir.
Thank you, madam.
sir.
Namaste. Thank you, sir.